video we are going to discuss a very common and important disease of the females, that is vaginitis, means inflammation of vagina. Inflammation of vagina occurs due to the different pathogens or different infections, or maybe non-infectious causes also present, and results in the abnormal discharge, pain and itching or pruritus at the genital areas. So these are the features which indicates that the female or the patient may be suffering from the vaginitis, and it could be of different types. It will depend on the discharge, color of the nature of the discharge, and the different diagnostic procedures will show that which kind of vaginitis is present. So if we talk the normal flora at the vagina, that the normal organisms present at the vagina are lactobacilli. So this is the normal flora of the vagina, and normal vaginal discharge is clear, can be clear or mucoid, especially at the mid-cycle. At the mid-cycle it becomes mucoid due to the estrogen surge. Mid-cycle due to the estrogen surge, and during the pregnancy. So mainly it is clear in the nature, but it becomes mucoid in the mid-cycle due to the increased estrogen and during the pregnancy, and becomes whitish and thicker. At the normal vaginal discharge, the pH is less than 4.5, that is acidic. So this is the normal discharge, and it needs not any treatment, and this is essential for the normal vaginal health and normal vaginal environment. But if the discharge becomes odor, malodor, or become fishy in odor, or it develops any different color, so or there is pain and itching at the vaginal area, then these are the signs of concern. We will further investigate. So three different main diseases or pathogens results in the vaginitis. Number 1 is Bacterial Vaginosis. Number 2 is Vaginal Candidiasis. Number 3 is Trichomoniasis. So discharge nature in the Bacterial Vaginosis. Bacterial Vaginosis is caused by the organism called Gardnerella vaginalis. It is an anaerobe, and anaerobe species are also involved. In this case, discharge is malodorous, often called as fishy odor discharge, and it is thin in consistency and grayish in color. So these are the features of the discharge caused by the bacterial vaginosis. In this case, pH is more than 4.5, that is less acidic and more towards alkaline. And if we do the microscopy of the discharge, then we will find clue cells. Clue cells. What are the clue cells? Clue cells are the epithelial cells which are covered by the bacteria. So if we do microscopy, we will find the clue cells, and treatment for bacterial vaginosis is metronidazole, and tinidazole. Metronidazole can be given orally or in the gel form. Tinidazole is available only in the oral form. Now coming towards the bacterial candidiasis. This is the most common cause of the vaginitis in the females. This is caused by the Candida albicans. It is a fungal infection. So it forms white cottage cheese like appearance. White cottage and clumpy cheese like appearance of discharge, also sometimes known as curd like discharge. In this case also pH is less than 4.5, that is acidic, same as in the normal pH. So pH is less than 4.5, and if we do microscopy of the discharge, then we will find yeast and pseudohyphae in potassium hydroxide preparations. So we will see the yeast and pseudohyphae, and the treatment for such infection is fluconazole, miconazole, butoconazole, so these are given as fluconazole given as per oral. Miconazole can be given as vaginal suppository, and butoconazole is given as vaginal cream. Given as a single dose. Now coming towards the trichomoniasis, that is sexually transmitted disease. And it is caused by the Trichomonas vaginalis. Discharge is malodorous, green, yellow, and thin. pH is more than 4.5, and if we examine the vagina and the cervix, on examination we find strawberry cervix. Strawberry cervix is the typical feature of the trichomoniasis, in which red punctate lesions are present on the cervix. Thus frothy for the exudate is present at the cervical os. If we do the microscopy, on microscopy we find numerous neutrophils, and treatment is metronidazole and tinidazole, both given orally. So this was the main features of the vaginitis, which is the discharge, pain and itching or pruritus at the genital areas caused by the inflammation of the vagina. And these were the different causes of the vaginitis. First we discussed the normal discharge, because we mainly differentiate the different pathogens and different diseases on the basis of the discharge of the vagina. So first of all we discuss the normal discharge, which is mainly odorless, or its color is clear or mucoid, and pH is less than 4.5. Then we discuss the different diseases, different types of the discharge in the respective diseases, and examination, microscopic and examination findings, and the treatment of the each disease respectively. So I think that you find it helpful